Um, we're going to get started because we have a couple of guest presenters today. I'd like to welcome Eduardo and Kyle from CDPH. I'll have them introduce themselves, and they're going to be doing a capacity building presentation today on CHIPS, so community health implementation plans and racial equity. So I'll pass it on to you.
All right, thank you, Leah. We're happy to, grateful to be here today. We're going to try to share some experiences and tools that we have incorporating racial equity into community planning and systems change work. Um, I'm Kyle Sullivan. I use they, them pronouns. I'm going to be providing an overview of a forthcoming one-year community health pilot project that we have cooking at CDPH that's just trying to align our chips with those of our community partners to help improve our racial equity impact. And I'll let Eduardo introduce themselves.
Hi, good morning, everybody. Eduardo Munoz, he, his pronouns, and I'm with the Office of Health Equity and Our Policies here at CDPH. Actually, one thing that we forgot to say was if you have questions, feel free to post them in the chat as we are presenting. But do know that we'll have some time towards the end to also answer questions if anything comes up. Yeah, so that is it that I have for today right now, and then we can move on with the presentation.
All right, sounds good. So for our first portion here, a little bit of background on this project I'm going to speak about. Because CDPH's own 5-year chip is still very much in early development, I wanted to instead share a new kind of shorter term project that still has its roots in our community planning program, in which we're trying to bring together highly data-driven racial equity planning created by the department into conversation with highly community-driven chips created by our community partners. And my hope is that you might find some of this relatable as you approach your own planning process. I'm going to give you some background on both projects and then talk about why and how we're trying to bring them together and end with some takeaways that we've kind of already gathered for our next 5-year chip. Eduardo, can I have the next slide, please? Formatting's a little bit funky. That's okay, though. So a little bit of background on the community-driven chips. Those are coming from our Healthy Chicago Equity Zones program. That's HCEZ for short. My office runs this program, and we fund and uplift health equity work by hyper-local neighborhood networks around the city. And we also support regional coordination within and between 6 geographical zones that together make up one Chicago. You can kind of see them outlined on the right here. In 2022, we provided funding and TA, or technical assistance, for over 50 neighborhood networks to produce their own CHNAs. Our funded partners were selected for their demonstrated commitment to racial equity work and bringing people together within their neighborhoods. And we structured the project in a way that promoted our funded partners to collaborate with a representative cross-section of community organizations within their neighborhood. We also promoted collaboration across neighborhoods and provided technical assistance with data interpretation and collection to help promote racial equity practices in the CHNAs themselves. Then in 2023, last year, we worked with those partners to create chips from their CHNAs. In order to help ensure that the chips and CHNAs were both responsive to the neighborhood conditions and needs, we took some steps to try to distance CDPH's influence from that process. Consequently, beyond the TA and the requirements for the CHNAs, we did not necessarily have as much oversight over racial equity strategies that they implemented. I know that oversight is a hard thing for a government body specifically to relinquish sometimes, but we know through the relationships that we built and the ways that these partners were selected that we can navigate that discomfort and cede things like resources and decision-making power to our community partners, because we know that they were doing the racial equity work before and have a vested interest in advancing that work through the HCEZ project. I'll provide a little bit of background on the project we're cooking in-house. Can I have the next slide, Eduardo? For the working title for this is Life Expectancy Action Plan. So a little bit of background. This is a separate project that spans our whole department that's focused on work being done by our programs and bureaus that's focused on exploring how we can leverage resources on a shrinking budget to make the biggest impact on our primary metric for success in Chicago, which is life expectancy. This project is set within our Healthy Chicago framework and really driven by the department's public health data and expertise. For some additional background, CDPH is engaged in a lot of financial planning right now around how we're going to transition as COVID-19 funds come to an end. We know we can't depend on the city to replenish that like really unprecedented budget. So we've developed this as an approach, a one-year pilot project, almost like a mini or like a microchip in itself to see what we can accomplish with a highly refined approach to the programs and resources that we already have. So in this project, we've broken down our life expectancy data to determine race, ethnicity groups, and neighborhoods with the greatest need. And we're trying to develop a set of actions to target the greatest contributors to life expectancy drops that could be implemented in 1 year's time on the resources that we have. And though each of these programs is bringing their like prior community experience, for example, our chronic disease program has been doing work for years. These action plans have so far been developed in-house primarily, and we kind of recognize the need to ground truth those plans and ensure that any new work coming from them is complementary with work already being done. So with that, next slide. We're trying to bring these two community planning projects into conversation with each other, and that's the step that we're at right now. So I want to talk a little bit about kind of how we're thinking through that and the benefits that we see coming from it. It's both an opportunity to build alignment and partnership and efficiency between our work at CDPH and that of our community partners, including the equity zones and those 50 neighborhood network chips. And we see that the work stands to benefit both ways from CDPH's data and the locally grown plans and contextual expertise of our community partners. And I think building that alignment opens up a lot of exciting opportunities, both to like reduce our risk at CDPH of producing redundant work and unintended impact, while uplifting opportunities to advance the plans that have already been laid in those neighborhoods. And to accomplish this, our bureau specifically, where Eduardo and I sit, is dedicating resources and staff to help make that alignment happen, to build dialogue and touch points between our community partners and these programs, potentially ones that didn't exist before. And I'm excited to see where this work is going to lead us. Our hope is that it will both impact our racial equity work and enhance its impact, and lead to stronger relationships going forward. And we already know that what the kind of the lessons we take away from this are going to inform our next 5-year chip. Have our last slide, or my next slide. The formatting. So through this process, this has already been a year-long project, and we're getting kind of towards the end here and starting to talk about implementation. But some considerations that I've already taken from this that I'm going to carry into our next chip. Is the value of leading with racial equity in the CHNAs to kind of set us up with success in the chip, and collaborating with our community partners early to help build a more responsive plan and earn that trust and support. The third being trying to be intentional and specific in how the commitments that we're making and then dedicated in our follow through. I think this 1-year pilot project with these very specific goals are going to be an interesting test of that for CDPH. And also encouraging us to think of the chip as an opportunity to address some of these like power dynamics that we have between the department and our community partners and consider what we might benefit from seeding some of that. And I know that in our next chip, we're going to rely a lot on the tools and the work that Eduardo's team has done and the Health Equity and All Policies team. And he's going to give us a bit of a rundown on some of that work next.
Thank you, Kyle. So yes, the next steps and the next work that it's coming up through the initiatives that are happening right now, we'll be using some of the tools that we'll be sharing with you today. But before I do that, I wanted to let you know what is like health equity and all policies, and who our team is. So my team is made up of 5 other individuals. We have another coordinating planner, senior policy analyst, and as well as project administrator. So the work that we do is intended to change systems on how policy decisions are being made. We work with many community partners, with government agencies on a collaborative phase to address the structural and social determinants of health. We do this by making sure that the community partners and our government, leaders are set on the same table so that they can make decisions equally and structurally. The aims of this process is to make permanent and structural changes and include, health equity routinely into all of the agencies, government agencies, as well as into the policy decisions that are being made. We work through this process and through 5 different elements, such as promoting equity, across the section collaboration, co-benefits for the multiple partners, engaging our stakeholders, and then of course, creating structural change and processes. Some of the work that we do is it's considered into 5 different priority areas, which is where we focus onto housing, access to food, environmental justice, the neighborhood planning and development, and institutional change. These priority areas are also aligned with Health Chicago 2025, and they're incorporated into all of the work that we do so that they can support the broader plan, which is the Chicago's Department of Public Health, Health Chicago 2025. So that's a little bit of background about our office, and the tool that we'll be, showing you today. It is in its final stages. And this is called the Equity Decision Support Tool. This tool was developed by our team as well as by IPHI and HIP and a few other partners, but mainly our IPHI partners were the ones that were really doing a lot of the background of the work, helping us through this process. And this tool was created for us, for the city, to city departments, elected officials, as well as organizations, to bring in equity and incorporate equity into their everyday decision-making process. This equity decision support tool will help, again, elected officials, city departments overall, and their organizations to be able to combine and collaborate together when it comes to either implementing a new policy or considering a new project, making sure that equity is at the center of the project overall. The HEAP team collaborated with a accountability body or committee where we had representatives from 9 different community-based organizations that helped us with the strategic input into this initiative that we have. So let me tell you a little bit about how this tool works and how it will be shown. This tool is basically to engage, with communities early and often, and to be able to collect information such as data. So we want to have the quantitative data, but as well as the qualitative data. And this is to build trust throughout their relationships and throughout the project overall. And again, this is engaging with communities throughout the entire process. This tool will let you identify to be able to know what is the intention of your project, so have more clarity, and who's going to be benefiting, what is going to be benefiting from this proposal, and why are you trying to benefit from this proposal. It's going to also allow you to examine and be able to go deeper to identify who are the people that are being most affected, or who's going to be the people that are going to be benefiting the most. This will also allow you to revise the work that you're doing. So it's not just a check mark all the time when you're reviewing or working on this tool, but it also allows you to go back and identify, if you are going through the right direction. This would also be in a way of implementing. So it tells you in a way of how you can check for feasibility, the resources that you need in order to be able to work on your proposal. And then, of course, is in the work of practicing accountability. So understanding the importance of community and the entire process. So this tool, as I mentioned, it is in its final stages. It will, we're hoping for it to be published sometime this year. But right now it is just has to have a few last revisions before we're able to be sharing it out. But we are talking about it to let you know that this tool will be available very, very, very soon. Now, we just didn't want to tell you and give you a nice teaser, right, to tell you that this tool is coming up. We also wanted to provide you some additional tools and resources that can help you with your planning and to bring in equity as part of your proposal or your plans overall. One thing to know is that our equity decision support tool did borrow some concepts from the DC Council, which is this link that we have here, from HIP, Human Impact Partners, and as well as from the GARE racial equity tool. So that is what we have today. I hope I do see a couple questions, which I will try to answer in briefly. But thank you all again for your time and having us here.
Thank you so much to both of you. This is really helpful. And I know that IPHI, even being involved with it, we definitely look at these tools and are planning to use them as well as we're both writing out the CHNA process for the Alliance and the CHIPS. So I just wanted to open it up. Were there questions for Eduardo and Kyle this morning? Okay, I don't hear any. So again, thank you so much for your presentation. We'll make sure to include the links in the information we send out to folks after the meeting. All right, so we're gonna move on to our next part of the meeting. Let me get my display ready for you. Okay. All right, so Sam sent out the agenda yesterday. We just had that really great capacity building session first thing. Sweepy is going to be up next. She's going to give us an overview. I'm sure you all saw a couple weeks ago that the Alliance website was down for 2 days at the end of July, beginning of August, and that's because our new website has launched. So they will be actually giving us an overview, a quick overview of the new pages. We have a couple survey updates, including our usual bi-weekly check-in. And then we have a couple focus group updates, just that we've been still scheduling. We've had a couple more focus groups take place since our last meeting, and we have about 15 or 10 to 15 that are having dates scheduled right now as we speak. Again, the focus group and survey collection is through September 30th. IPHI, we've met with both health departments and Metopio last month, and we've also had 2 additional meetings with Metopio, have another one tomorrow. And it's because we're working with them with their new, they have a newish tool that wasn't around during our last cycle that will allow us to integrate the focus group and the survey data into the Metopio platform so that when we pull data for you all from Metopio, it can also incorporate that qualitative data. And for those of you who have Metopio subscriptions, we're looking at processes or ways that we can also make it so that you can access that data as well. So just an update on that. On the timeline, we do have a couple of reporting related items, mostly just a heads up that we've already been working on the background research for the countywide report and identifying new and upcoming or new and emerging research around the different topics, all from a racial equity lens. I didn't include it on the chart, but that started actually last month. So we've been working on that. It was slated in the timeline to start in August. Oh, and sorry, in addition to that, focus group updates, IPHI has brought on a new facilitator who has a lot of availability. We did a focus group in partnership with Loyola on Tuesday, and they were able to observe. They have a lot of, they've worked a lot in both DEI, racial equity, conversation facilitations, and their particular area of expertise is with youth and youth organizing and facilitating youth action. So Lori folks in particular, if you have focus groups that you would be interested in having them potentially facilitate with youth, they are skilled in both youth and adults. So just wanted to highlight that. Their name is JJ. So as we're scheduling things and you all are usually, the hospital partners, y'all are usually CC'd on the relevant focus groups, you'll start seeing them included on the communications. Any questions about the agenda or timeline? Okay, so I will pass it off to Sweet Pea, who will give us an overview of the new website.
Hey everyone. Thank you for giving me some time to chat about the new AHE website. I'm really excited about the final product that we came up with. And I'm thrilled to show it to y'all today. So you just give me a second. I'm going to go ahead and share my screen. Okay, and move y'all over here so I can see what I'm doing here. All right, perfect. Well, this is the new home of the Alliance for Health Equity online. I would love to hear any feedback that y'all have about the website, especially as you jump into using it. If there are any hiccups or snags, definitely let me know so I can get that fixed on the back end. But as you navigate to our site, you will see, of course, a banner at the top about our community input survey that we are doing right now to hopefully get folks pulled into that as soon as possible. And then I'm just going to walk briefly through some of the different tabs we have to see where you can find some things. So just starting out, of course, we have our homepage and highlighting the different things that we are able to do through the Alliance for Health Equity across both Chicago and Cook County. And highlighting all of our wonderful partnership with y'all here with us today. And just kind of looking at some different resources that we have, some of the different blog posts and things that we've been able to create, and pulling folks in to be able to work with us and ask questions and things. Moving over, we have the About page that just gives some more information about who we are. I'm going to skip over that because I think, y'all are who we're talking about. So we're pretty familiar with each other at this point. But jumping over into the projects page, this is where you can find the real meat of the work that we are doing between here and this actual CHNA reports that we'll look at next. Here we have laid out all of our impact areas to really showcase the spaces that we are working in to build health equity across Chicago and suburban Cook County. And of course, an invitation for folks to join our work groups. You can see the 4 different strategies that we utilize to serve folks in this area, and also some information about the community health needs assessment as well. We have our 3 main work groups around food, around housing, and around mental health as well. And you can see with housing, our Illinois Medical Respite Capacity Building Program that has really grown into a much larger program. We have additional information that you can click on to see more about that there and how that is working not only in Chicago and Cook County, but also across Illinois. And then, of course, the main thing, or one of our main actions within the Alliance, completing the community health needs assessment, and more information about how you can access that there. Now, going back up to the top, you will find that you can access all of our CHNA reports from 2022, 2019, and 2016. So these will be available if you have any questions or concerns about reaching those. Definitely, again, let me know and we'll make sure to be able to connect y'all there. And then we also have some resources around those topical working areas, around food, housing, and some equity resources for folks to use as well. And then, of course, we want folks to contact us. So, this is another way for people who are interested in partnering with us or further interested in our work to be able to connect with us, so we can get them the information that they need. I feel like that was, Leah gave me 5 minutes. I feel like that might have been sooner than 5 minutes. But does anyone have any questions or thoughts before I hand it back to Leah?
We do have a little bit of extra time in case folks have questions or feedback about the site. Great. I'd really like to thank Sweet Pea for all of their work on this with the contractor. If you all remember, we had multiple sessions last summer where we collected input from you all about the design, what features you wanted to see, and they really took it and made sure to implement those recommendations as much as possible within the work. So we really appreciate all the work. We're excited to have this new functional, easily updatable website that should serve our needs much better.
All right, well, I will pass it back to Leah. Thank you all. And yeah, go on ahead.
All right, thanks. Okay, here we go. All right. So we're going to get into the survey updates. There have been quite a few developments since even our last update that we provided last week. We sent out a communication 2 weeks ago that our update would be a couple days later than normal because we were attending events. So this update will be actually since these numbers are the updates since July 30th. So just about a week and 2 days. So keep that in mind as we go through. IPHI staff, we've provided support for survey collection at a number of events in the past month. Speaker Welsh's annual back to school fair, both Loyola and Rush were hosting at that event and collecting surveys. Hope Fest, we worked with Elvis, Advocate, Lutheran General to provide surveys. We tabled at the Healing Arts Fair that was hosted by DCASE. And the Chinatown Summerfest Northwestern tabled there with surveys. And then IPHI also worked with Northwestern to table for all 3 days of the Black Women's Expo this past weekend. Were there any questions? Okay. Oh, sorry. Go ahead, Elvis.
So we have an event that we participate in the Lakeview area for Illinois Masonic, but September, I believe.
Oh,
Are you
great.
doing those in
Yep.
September or no?
Yeah, we have a bunch planned and we have additional events planned for August and September. So yeah, just send us an email. We'll connect with you and see both availability and also like what we can do to help support either with providing materials or assistance with tabling and collecting surveys at the event.
Yeah, sounds good.
Awesome. Thanks, Elvis.
Hey, I have a quick question. How
Sure.
much advance notice do you need to table at an event?
We don't need a ton. as Northwestern, like we're really, we don't, ideally it would be great if we could have a week or two to plan, but we have done like less than that. It's just our likelihood to be available to be there in person is higher the more advance notice we get, if that makes sense. But we are able to pivot pretty quickly. Just our guarantee on whether we can make it work is much higher if we have more time.
Got it. And so then
Yeah.
just email you and Sam.
Yes, yes.
Okay. All right,
Yeah.
cool. Thank
And we'll
you.
make sure it gets updated on the calendars and everything. And we'll reply pretty quickly about our um uh sorry, lost my train of thought. Because I was trying to read comments at the same time and I know I can't do that. All right. Yes,
You're just
email
saying you'll
myself
reply
and
pretty
Sam.
quickly about the
Yeah, yeah.
events. Yeah.
Yeah, and our
Okay.
availability. Thank you.
Okay.
Yeah.
No problem. Thanks.
And we've been doing both weekday and weekend events. So don't just whatever you have, let us know and we'll let you know what we can do to support.
Okay, perfect. I just know there are quite a few like back to school events and community outreach events that are happening. And there was one big one that happened, and I thought about you guys, but I just thought it was too late. Now it is too late because it's already happened. But there,
Mhm.
there are some more coming up in the Southland area.
Yeah, and with a short notice, like if you have a shorter notice event, it's definitely easier for us to get in if you already have a table. So that like we can just piggyback off of your table or not even if it's a table, but whatever. If you all have a station or stuff you're already doing, it's actually easier for us to piggyback off of that and bring supplies. I mean, we have tables and chairs and stuff. It's just if we have to reach out to event organizers and request that we be assigned a table, that usually takes a lot more lead time, and sometimes the events are full by the time we get notified about them and we can't get a table out of them, if that
Got it.
makes
Okay.
sense. Yeah.
Yeah. Yep. Okay. Duly noted. Thank you.
Mhm.
This is
Oh, go
sorry.
ahead.
This
No,
is
go ahead.
Dana from Lurie Children's. I just had a quick question. We two quick questions actually. One is the Bud Billiken Parade is this weekend, and I was wondering if there are any plans to distribute the survey there. We typically have a booth, but this year we don't have a booth. And instead we'll be participating in the parade, but I just wanted to elevate that just in case others are going or if it wasn't on your radar. Um, and then
I know
second,
Northwestern is attending. It's just we don't have the staff to do the parade this weekend. I
okay,
know Northwestern is planning to be there. I'm not sure if they're planning to distribute the survey, and I don't see anyone from Northwestern on the call at the moment. But I could check in with them and see if they're planning to do survey distribution at the event.
okay, yeah. One thought might be if we can connect with them to see if we can, like, for instance, provide those iPads for survey for folks to be able to take it in person. And then the other question I had was regarding well, actually, it's not a question, but a point. We will be attending the Belmont Reagan Elementary School back to school
Okay, great.
event, and another. We have two on our radar for this month, and I'll be reaching out because we may need support with survey dissemination for that. But does anybody know any back to school events taking place in Austin?
Um, there
I
is
know.
one that on Eventbrite, Zaina,
Okay,
I don't think it's direct. Oh, let me look. I saw one a couple days ago when I was looking specifically for back to school events that we could potentially do. Let me get back to you. There was one that was on the west side in the city, and I remember it being near Austin. So let me check on that for you.
okay, thank you.
I don't remember, I don't think it's a back to school event specifically, but I know I think it's a house in Austin is having a block party or open house or something coming up soon. I can try and find that information and share it. because I don't remember the exact details.
Thank you. Yeah, if there is one in Austin, we will plan on going and then can share the survey there.
Awesome. Yeah. And Zaya, I'll connect you with the team at Northwestern directly. They work, I'm sure, Lisa, she's leading up the community team that's going to be there. She runs the community team that will be there at the event. So I'll just connect you directly to them, and then keep us in the loop, and we'll, even though we're not able to be there, if folks need us to supply paper surveys or something, we might be able to work something out tomorrow to get those materials delivered.
Thank you.
Mm-hmm.
I did want to I see that Lawanda in the chat had mentioned that Danny Davis always has an event in Austin. I did just look up the event that Sam mentioned by a house in Austin, and it is this Saturday, the 10th, Zaina. So I just wanted to raise that as, I don't know how feasible that is, but it is a block party, but it's also, a book bag giveaway and back to school gift cards and more. So it's being pitched as a back to school event. So we'll send you that info, but it is on Saturday.
Thank you. I appreciate that, Jess.
Sorry, y'all. I'm just responding to a comment real quick. Okay. Thanks. Did other folks have, this is great, and we'll go in a couple minutes about why we're really trying to get connected to partners around events and whatnot in the next couple of months. Are there any other folks who have any that are popping up immediately for them that they'd like to mention? Okay. So in our last update, I know that Sam mentioned that paper surveys have been far more successful at events compared to QR codes. This is always hard to predict, as you all know. And in previous cycles, the bulk of our surveys have been collected in paper format. I did sort of a rough analysis on our recent events to see like what the numbers are looking like in terms of QR codes versus paper. So I have that on the slides with the survey update. So with that in mind, I think that a lot more of our survey collection this round is going to end up being paper, compared to what we originally thought. So IPHI has actually brought in 3 contractors to assist with survey entry. So one that will be able to do the English and Spanish survey entry, and one that will be working on the English specifically. And then we have a contractor that will be able to enter the Mandarin surveys as needed. So please coordinate with us on any paper survey entry. We are also trying to keep track of how many paper surveys we have out there. So even if you have internal capacity to enter the surveys on your own, if you go to an event, just give us a heads up. That way we can keep track of what to expect in the online system and can follow up with folks, and make sure that we can provide support with survey entry if you need it. So please keep that in mind. We do have 3 extra staff that are not staff, but contractors that we have brought on to do survey entry. So this is the estimates of the QR code versus paper survey return. So at the Speaker Welsh Annual, and how this is done is that we count the number of paper surveys that are collected, and we look at the QR codes that were returned during the time period of the event. So it's not an exact science. Again, this is just an estimate. So at the back to school fair that Loyola Rush and Rush were a part of, we had 75 paper surveys and 2 QR codes that came in. for the Healing Art Fair, we had 20 paper surveys, 7 QR codes. So the Black Women's Expo, we did have about 120 surveys returned for both the Chinatown event and the Black Women's Expo Day 1. Unfortunately, the surveys got mixed, so I can't give a good estimate of the QR codes versus paper, but for days 2 and 3, these are the proportions. So you can see that the paper surveys were returning a lot more. Demographically, it's kind of all over the place. We are seeing that younger folks are more inclined to take the QR codes on their phones, but it's not a hard and fast rule. And again, even with younger folks, the paper surveys are still ending up to be more popular. One change that you'll notice on day 3 of the Black Women's Expo, the QR code numbers are higher. At that expo, we would have lulls in traffic, and there was a free merch table that had a line that probably had a 20 or 30-minute wait that went past the directly in front of the Northwestern booth. So we were distributing QR codes in the line for folks and saying, hey, once you finish this, once you get out the line, come over to our booth, show us the completion thank you page on the survey, and we'll give you a free water bottle. And that seemed to boost the numbers on QR codes pretty well. So that is one exception. Like if folks are waiting in line for stuff, or like you're having like A1C levels checked or free blood pressure checks, that is an opportunity to distribute the QR codes that seems to work decently well. In terms of what we found helpful for survey recruitment at recent events, providing incentives, and I know all of y'all are old hats at doing community engagement, so this is not news to any of you, I'm sure. We just wanted to bring it up to tell folks what we've been finding to help at recent events. So providing incentives for survey completion, water bottles, reusable shopping bags, and Play-Dohs have been our hottest incentives this year. And even at events that aren't child focused, not only do they draw young folks in and also potentially get their parents to fill out the survey, but even at adult events that are primarily with adults. Adults are limited for stress relief. It's a slightly less expensive option compared to the bags and the water bottles. In the past, we've also seen like hand sanitizer and things like that work, but these are a few that have been wildly popular lately. Have chairs and clipboards available if you can. Because the survey is a bit longer than our previous cycles, the chairs and the clipboards are really coming in clutch because it is taking about 5 minutes for folks to complete it on their phones, about 7 to 10 minutes still for folks to complete it in paper format. Explaining the purpose of the survey. So one thing that's really hit home with folks is that like not just saying this is a community input survey, but saying like this helps hospitals and health departments figure out like what communities would like them to work on over the next 3 to 5 years. Really, I think has been winning over a lot of people with taking the survey. Also mentioning our partners, and you all work at hospitals, so you know how it is. Every once in a while, you get someone who's like, I already go to Northwestern, or I already go to Advocate. Like, why do I need to, like, they already know what I need. And I say, but actually, the survey is helping to inform all of these partners in Cook County and the city. It's helping to inform the processes of both the major, like, health departments. So knowing that it's more than just whoever happens to be hosting the event seems to be boosting people's willingness to respond as well. Are there other folks on the call who have other strategies they like to highlight that have been working well for them so far? All right. So again, this is not news to folks, but we just wanted to mention them real quick. So we're going to go on to the August survey updates. So I mentioned at the start of the call that the last update was on July 30th. And in that 9 days, we've nearly doubled the number of survey responses. And I know that IPHI, we have about somewhere in the neighborhood of 300 paper surveys that have not been entered into the system yet from recent events, including the ones from this past weekend. We know that our partners have somewhere in the neighborhood of another 100 to 200 paper surveys that have not been put into our system. So we've, in the span of a little over a week, nearly doubled our survey responses we've received, and that's not including a large percentage of the paper surveys that are coming in. So we are seeing results from the efforts that you all are doing. We're starting to see rapid increases in even the daily rates of return. So I want to thank you all for your efforts. We are really starting to see results from all of those. So we really appreciate it. The other thing that was mentioned in our last survey update that I have not brought up during this meeting is that Sam and I also identified a number of online community groups to post the survey in. Some chronic illness groups, the Chicago Queer Exchanges, Chicago Moms, that it includes the suburbs. So we've been posting the survey in a number of different active online communities in an effort to also boost our demographic responses. And we are seeing, with the exception of gender, the gender skew, we are seeing some really great demographic diversity. So our numbers are rapidly increasing. They're still on the low side. We are going to be seeing some significant jumps in the near future as more and more surveys enter our system and more events are attended. But I want to applaud you all and your efforts because the demographic spread is actually pretty excellent at this stage. So in terms of age, we're having a pretty good response rate with younger folks, and we have a decent spread across all the different age categories. Over 17%, a little over 17% response rate of participants being in the 14 to 17 range is really good. We're already exceeding numbers from compared to our last cycle in terms of the younger age groups. So that's well. So in terms of gender identity, we're brainstorming now on what we could possibly do to boost the gender expansive as well as male identified folks in survey responses. We expect that this female skew is going to get a little bit worse as we enter surveys from the Black Women's Expo. Obviously that was a gender focused event, so this is probably going to get a little bit more pronounced in the near future. And although these numbers are low comparatively, again, we are still exceeding the numbers we are seeing with much higher survey responses. Like if we're just looking at the raw counts, the counts themselves are better compared to our last round. So that is encouraging. We're also seeing more representation from folks with diverse sexual orientation. We're seeing a really good diversity in terms of racial and ethnic groups, with African American Black identifying folks still leading as our top subpopulation. We are a little bit high on the college graduate or higher, but this is the highest levels of younger elementary age kids and high school age kids, or I'm sorry, not age kids, high school educated and elementary educated, and middle school educated. These are the highest numbers we've seen in a survey so far. In terms of annual household income, we have about 25% of folks that aren't wanting to respond to this question, but again, we have a pretty even spread among the higher across the income categories here. We saw a increase in the number of folks responding who had a person in their household living with a disability. Our rates for caregiver support needed were about the same. About 50% of respondents are employed full time, and about 95% have stable housing. I think as we get more surveys in from the focus groups as well, that are looking at speaking to folks who fall into more of our priority populations around housing or food access, we might see some more diversity in the housing responses. Let me make sure. Okay, so before I go on to the map, are there any questions that folks have? Okay. So this is this updates map. We're seeing a pretty good, again, a pretty good geographic spread. There is no one geographic area where we're seeing significant like areas that are just not receiving surveys at all. We'll be working a bit on these north suburbs and the southwest suburbs. Those can sometimes be challenging places. And one note, this data hasn't been cleaned to sort of take out the folks who are outside county, and some of these, like this is Hinsdale, some of the zip codes overlap the county line. So these folks are actually within Cook County. It's just the zip code is located weirdly when you map it, it's located outside the county. So that's just a note. The ones that are on the border typically are within Cook County. And when this data is clean, these responses will be taken out. Hey Erica, yeah, it's on Tableau, so I don't have like, I should be able to create a public link to share it with y'all. So I'll look into that when we send out the slides. And then this will be in the slides as well, but in Tableau, you'll be able to highlight, if I'm able to get you all the link, you'll be able to highlight it and look at the data. If y'all are interested, I can also send you the zip code numbers. All right, any questions about that? Okay, I will pass it over to Sam for a quick survey, or sorry, focus group update.
Good morning, everyone. Leah, do you mind? Thank you. So focus groups, we've been working hard to get more on the calendar. We're in the process of scheduling and discussing focus groups with several groups across the city and county. And we had one with the Community Benefit Council earlier this week at Loyola. As Leah mentioned, we also are really in talks with a couple of groups that have very specific populations. For example, the MCC is I believe it's the Muslim Community Center, so they have that population that at the moment I think is underrepresented. And the Midwest RUFA, a lot of their population is Orthodox Jewish, so that's another population we're looking at, as well as several different areas of the city, different economic statuses, different racial ethnic statuses. So we're really working to hit those priority populations. As usual, continue to send us anything, any suggestions you have that were not already on the list, or connect with people, especially if it's in the contacted column. That might mean that we're having trouble hearing back from them. And so an extra boost from people who already have the relationship often helps a lot to get it rolling. And then we take over the scheduling and things like that. Yeah, that's what I've got.
Hey, Sam, this is Dolores. Got a question about that too.
Sure.
So I know we had talked about specifically like for Cook County, some of the target areas as far as geography is like the southwest and like the north suburbs. But are there target audiences that you're trying to reach? Just looking at some of these, I'm just trying to see if are there like organizations or are there specific residents, specific communities that would kind of help us narrow down our ask.
Yeah, we really want to get into those priority populations. So for example, communities of color, people with food or housing instability, different groups as far as like religious groups or cultural groups. We want to get if we can have any connection to people with disabilities or survivors of domestic violence, anyone in the LGBTQ plus community. So those priority populations that tend to be underrepresented are the ones we're prioritizing, in addition to trying to get a decent just geographic spread. Oh, and youth
Okay.
also.
Okay, got it. Thank you.
So I entered in about the West Cook Y and the Pav Y MCAs. The West Cook does actually house gentlemen in there, so it hits multiple. It hits those that are, having a risk to be unhoused, as well as a lot of gentlemen, because it's only for men. So I would really think that would be a nice for either focus and a focus group, as well as maybe just even setting up if you guys are willing to set up a table outside there. I'm sure that's not the only Ys. And the PAVY, they have a more of a senior population. And I think they do I think they pick up lunches or food drive, mobile food pantry, and that might be another good location.
Okay, great. I'm pretty sure we reached out at least to the PAVY. I'll have to double check the West Cook Y, but we'll make sure to follow up with both of those.
Well, and Erica just sent me a message that they didn't have capacity to gather a focus group. So maybe it is more that maybe Eric and I can try to get, flyers there. So if people are waiting in line to get their food, that might be an option. But I do think the West Cook Y will be open to that.
Okay, great.
Yeah, and we'll make sure we reach out to Michelle too to see if they would be okay with us possibly, maybe we can go to a couple of days where they're doing meals or intakes and possibly do some survey distribution as well. I think that's a great idea.
Thank you.
Is there another, or is this a platform to say kind of what we have confirmed or completed at this point in terms of focus groups or?
Yeah, I think we need to update ours for yours, Julia.
Yeah. Yeah, because we've had a couple happen already. We have quite a few more scheduled already.
Yeah.
I will say that we did get a chance to do Resurrection Project on Monday, and the space was incredible. It was majority men, so I think we had 11 men in that space, and they were talkers, which was nice. It's not,
Yeah.
it was very nice to have them be in that space. So we do have our notes. We'll start collecting those and put them into a folder so that you guys will have that. But we definitely have an update. And also in East Garfield Park, we have a session with men from Breakthrough. And so that's been scheduled out as well. And then we have another one for Oakley Square Apartments that's going to be this evening at 4 o'clock.
Awesome.
And so,
Yeah.
and so what we've been doing for our surveys is just the folks we have the QR code, and so we kind of put them around the table. And then because most spaces don't have a smart board or things like that, so we just have people as they're coming in before they're grabbing their food is to scan the QR code and do the surveys. And so that's been working out really well for us.
Awesome. Great. Yeah, that's good to hear, Julia. Yeah. And if you come across a population where you all need us to like if you need to shift at any point to paper surveys or for like a particular event or anything, just let us know. And like I said, we have increased our capacity for paper survey entry. I know that your team often is usually the ones who are able to do it themselves, but if you all need assistance with that, let us know. We have the folks to do it.
Okay. That's super
Yeah.
helpful. We did an event, and I'm not sure if if Jess said it, but we were at Proviso West, and we, as people were picking up their food, we were telling them that they needed to do the survey first. So we had a lot of paper surveys in that space as well. So I'm not sure if those have been entered already, but that was around July 20th that we did that event.
Yeah, and that's in our count of ones where we're like, we know they exist, and we know who has them. We're not sure if they've been entered yet. I have followed up with them, but that's all the other reason why we want folks. We want to be able to check in and make sure folks are doing all right with the paper surveys, or if we need to go and pick them up and send them along through our folks to get them entered. So hopefully we'll have those in by the next update for sure. They might be and they might not be. I'm not sure at the moment. All right, we're a couple minutes past time, but I really appreciate everyone, all of the work you're doing. I know your teams, we've been out with a lot of you. It's been great. I know that Advocate, you all said that you'll be at the Bud Billiken this weekend. So let's definitely, I will tie Advocate, Lurie, and Northwestern. I will tie you all into a single email thread and be like, let's coordinate. So be on the lookout for that, all right? All right, thanks everyone. Sam will be sending out the update early next week just because we have so much data collection, not the survey update, sorry, the post-meeting materials early next week. And we'll be in touch about various things and also be sending out another update in a couple weeks as well. All right, thanks everyone. Have an amazing rest of your week.
Thanks, Leah. You too.